Days of Christmas, so we're doing a syringe of the Versa today. And the goal for today was that we wanted to do a little plumping around the lips and a little bit in the creases. So Tammy, what was it that inspired you to do a cosmetic treatment?
Actually, watching your videos really gave me the confidence to come in, and I felt like I was going to be in a very safe place with a competent doctor doing my treatment. So that's what encouraged me to come in.
Wonderful. Well, we put out as many teaching videos as we can so that you can see there's complete transparency. When you have the right information, you can make the right decisions. Starting with, we'll talk about the ABCs of plastic surgery. So for the physicians and students that are watching, I like to use our Avogard and, of course, gloves. Now I use the Hibiclens to cleanse the face. I'm going to be doing some numbing medicine. It looks like I'm going to do one additional syringe of the local anesthesia. Let me just see if she can grab that for me one moment. Okay, so she's bringing me in. I'll need that. I like to use 2 syringes of the local anesthesia when I'm around the mouth, just in case I need it. I won't always use all of it. I'm doing a modified dental block, and I'm wearing my disco ball uniform today because we're celebrating the new year. Woo! And we're past 2020, and difficult year for many people, and we made it through. So the Hibiclens. Thank you, lady. Appreciate it. So I'm going to do a little cleanse. Rest your head all the way back for me, please. Around the mouth. We're going to do a little plumping, not too much, and then the creases around the corners. And then I'm going to use the alcohol swab. I'm going to use a 32 gauge. Now I like to put a little bit of lidocaine. I put 0.3 cc of lidocaine in the filler. That makes it a little less viscous, a little easier to inject, and a little more numbing medicine is always a good thing. And then, of course, I'm going to make my marks with our little white pencil through here, and it's the corner of the mouth that we're going to focus on. So that way I'll show Tammy one more time. Hold this for me, please, Tammy. So we're going to do a little plumping across the lips, the corners in through these areas here and in here, and then just a little touch across the top. Is that what you're thinking?
Sounds good.
Okay, very good. One step at a time. So now I'm going to do a little bit of the numbing medicine, and I like to use the buzzer as well. So have you rest your head all the way back, please, Tammy. I'm going to lift her lip here, and you'll feel buzz, pinch on 3, 1, 2, 3, pinch. And a little numbing medicine. You feel big pinch, little pinch, not too bad?
Not too bad.
So if you feel little pinches, it's really important that the patient feels comfortable during the treatment because you will get a better result. It breaks my heart when patients tell me they went somewhere else and then they had a very uncomfortable experience. So it's really important to numb very well, and we're not in a hurry. This takes me a minute or two, a little pinch here, to do the modified or dental block. Now, the ABCs of plastic surgery, when you know the ABCs, you will make better decisions. So please share this video so everyone can learn the ABCs of plastic surgery. A stands for areas. There are 4 areas we address. Tammy, how you feeling?
Feeling good.
4 areas we address to improve the facial appearance. If we sag, we tighten. If we lose volume, we fill. And that's what we're doing today. Sun damage, wrinkles, and sunspots to the skin, little pinch. We can polish and repair the skin. The 4th area is better than everything else, and that's our behavior. And nothing looks as good as Mother Nature's free facelift when we smile. And Tammy's a good smiler. She knows the power of smiling, and that is our model. When you smile in the mirror, that shows us what is desirable, what looks good, and what we need to emulate. So A is for area. B of ABCs is for boundaries. What are the rules for good plastic surgery? Safety is always first. You must look natural. Let's prevent future aging changes. And let's get as much improvement as possible. Now, we're not God. We can't make things perfect. We do the best we can, and if we need to come back another day and do more. You feel a big pinch there, a little pinch, not too bad?
Nothing.
If you need to come back another day and do more, that's better than going too far. So now I blot across the lips because patients will think, am I drooling? And you're not drooling,
Okay.
I promise. And if you're blotting, obviously, you need to let the patient know so that they feel comfortable. So do you feel a little bit of a pinch here or not really?
I don't feel anything.
So I do a little extra numbing across through here. And Christine is our camera person. Thank you, Christine, for doing a great job. And Laney and Caitlin got everything set up so that it makes it so easy for me to do what I do. We have the best team. So I talked about A and B of the ABCs of plastic surgery. C stands for combination. If we want our best results, we combine. We combine tightening, volume, and skin to get the best results for cosmetic treatments. Now, if patients tell me they want their best results, but they just want to do one treatment, then we usually talk about tightening, pinching there, pinch here. Best results with no downtime is fillers. Fillers do a great job, but they don't give us a lift. And lifting, I get wonderful results, but I can do even better, a little pinch, when I combine. So if you know those three categories, pinching, then if you're happy with your result, with what you've chosen, great. And if you decide that you need more, you know which category to go to next. Now, with the hyaluronic acid, we call that the fine line filler, and that is a reversible filler. We're going to be using the Versa today, and I did inject, I put an additional 0.3 cc's. Let me see if I get this. I'm just going to put it all in one syringe here. 0.3 cc's of the lidocaine in with the filler itself, so I've got it all in one syringe here. And so I'm going to start with the creases around the mouth. So we can't take away 100%. You feel a little bit of pinch here, not too bad. So this is an intradermal injection. So the intradermal injection, you can literally see the creases softening. And corner of the mouth, we get that downturn of the corner of the mouth, little pinch there. Tammy, how you feeling, dear?
Wonderful.
She's tough. We try and make it easier than getting a tattoo or going to the dentist's office. So a little softening of the creases here. A little softening, you get a little crease here above the corner of the mouth. Everything's looking good. Thank you for watching. Thank you for sharing. Let someone else know about the ABCs of plastic surgery. We're on a mission to stop bad plastic surgery. We're here to help you raise your standards with cosmetic treatments, and we're here to help you do it the right way. Experience matters. We are a center of excellence. Where else can you go where the injector has done over 20,000 syringes of filler injection? You get the hang of it after 20,000. And a lot of people out there are injecting, but just because they're out there injecting does not mean that they're an expert. Experienced, are they paying attention and following the ABCs of plastic surgery? Most injectors don't even know the ABCs of plastic surgery. And you're going to feel a little pinch out here, a little pinch. And there's an extra little crease that I see, and that's my discretion when I see that extra crease, that I want to just treat a little extra. I think Tammy's going to appreciate that. And
Dr. Rich?
yes, go ahead.
For the people that are just joining us, would you please repeat what you're injecting today?
We're doing a syringe of Versa. Tammy is our lucky winner of the 12 Days of Christmas. She's been watching our Facebook videos, so please share them so that others can learn. And today, Tammy is a giver. She's retired. She's a former teacher, preschool teacher for many years, the special needs kids, and that takes a special person to do that. So what an honor it is that we can take care of Tammy today. So now, do you feel a little bit of a pinch here or not really?
Not really.
So a little pinching through here. So now I'm feeling the vermilion border. And when you do little tiny bits like this, it's very difficult to get into trouble. This will keep you safe. And you do it one little step at a time. Now when you look closely at your lips, you will see that everybody has a little asymmetry. Now of course we never see ourselves the same way that other people see us, which is interesting because we're looking at the same thing, but we definitely don't see it the same way. That's why you need to have a conversation with the right expert, because that is the reason people go too far. They get into trouble because they're too hard on themselves. I will protect you from that. I will not let you go too far. But as you can see, patients come in. That happens all the time. People always tell me, why do people go too far? So that will not happen to you here. And you can see, even though I've treated in these areas, she still looks natural. Now we're going to treat the other side, but we're keeping her on track. How are we doing so far, Tammy?
Wonderful.
Very good. Now her lips are going to feel goofy with the numbing medicine for about 30 minutes. Everything's looking good. Very good. Perfect. So the vermilion border, and I'll put about 1/10 of a cc in each quadrant. So that's just a little filling and plumping to define the lip. Now we'll add a tiny, tiny bit of volume, just enough and not too much. And again, I'm going to focus on the little crease here. Now, after you do the filler, the hyaluronic acid will absorb water. And so as I tell patients, you don't want to taste the chocolate cake before it's done baking, because you'll still see improvement in the result over time. So now, and I'm also going to do some massage across these areas. Massage, massage, massage. I tell patients, if you see a little bump or a little something with the filler, just massage it down. You won't hurt the filler, you just help to soften things. So, another little tiny pinch here. Everything's looking good. How you feeling, Tammy?
Great.
Good. So this is in the substance, in the body of the lip. We're in the Villages, Florida, in Tampa, Florida. I'm Dr. Rich Castellano, double board certified facial plastic and reconstructive surgeon. You're just joining us. For the physicians and students that are watching, this is hyaluronic acid filler. Looks very natural. It's not overdone. Nobody wants the overdone lips. Nobody wants the lips to enter the room before they do. Nobody wants the trout pout, so we're going to avoid that. We will not let that happen here. Very good. Thank you for watching. Thank you for sharing. I have patients from all over that tell me, I like your technique. I like how your minimalist philosophy, that you still get results, but you don't go too far. And when you're doing little bits at a time, you're not going to get into trouble by taking this approach. Now, as I tell patients, even if I injected nothing and I just passed the needle, you'll have a little bit of swelling from what I do. So what I'm going to do now, because I have a little bit left of the filler, I'm going to do some massage first, and I'm going to show Tammy what we've done so far. A little thickening of the skin. The intradermal injection is like thickening of the skin, and it treats those little creases. So I'm going to set this here. So how does it look so far? Can you see how it plumps the lips?
Oh, wow.
Do you like what you see?
Mm-hmm.
With what I've got left, I'm thinking of doing just a little more in the crease lines through here.
Mm-hmm.
Is that okay for you?
Mm-hmm.
Make a big smile for me. The smile will feel goofy with the numbing medicine, but that will come back for sure. So we're on track. We want to make sure Tammy's happy. So I'm going to do a little bit more down in through here, and we'll wrap things up, okay?
That's it. You did more right here.
I can add a little bit more in those areas. I'll put a little touch. Now there's a limit on how far we can go, but that's good to get her feedback. I'm going to add just a little bit more
Looks good.
to those areas. I'm glad you like it. One step at a time.
He is so gentle too.
Let me have you rest your, thank you. Let me have you rest your head all the way back. Yes, if patients are not comfortable, then I'm not comfortable. So, and you get a better result when patients are more comfortable, because they are the canvas of the artistry. You cannot have the canvas moving all over the place to do a good job. So this is a common area that we get a little bit of a hollow, so I'm going to add a little bit there per her request. I think that's very reasonable. So we've added a little bit there, and now a little pinch here. Add just a little more. Building that volume. It's very natural that we lose volume as we get older. Little pinch. So as you can see, lip filler, no downtime, looks natural. The numbing medicine will fade away in about 30 minutes. Some people do it without the numbing medicine, but I feel you're going to get a better result. It's just more comfortable when you're numbing the lips. So Tammy, how does it look so far? I put a little bit more in those areas and then around the creases. Make a big smile for me, big smile. So it's going to feel goofy with the numbing medicine, but it looks natural, not overdone. The swelling's going to settle. The filler will absorb a little bit more of the water, and then at 6 to 8 weeks, I want to take some pictures before and after side by side. If you need me before then, you let me know. What questions can I answer?
Well, really, you answered everything, and I think it looks great.
I'm happy with what I
Very
see.
pleased.
There is a little bit of numbing medicine. There is a little bit of swelling, so we're right on track. I give you the hugs and hugs from here. Congratulations to our lucky winner, the little knuckles and the elbows here. Hugs to you as well. Happy New Year. It's 2021. We're here to celebrate. When you look good, makes you feel good, makes you want to do good. ABCs of plastic surgery. Let's do this the right way. We're on a mission to stop bad plastic surgery. I'll see you in the next video, and we are going to help you raise your standards. Congratulations, Tammy.
Thank you.
We'll see you. Congratulations. See it all in your eyes.